Alright, I said that in a fetal life, there is a connection between the pulmonary trunk and what? The arc of aorta. Now, that connection is called ductus what? Arteriosus. So now, the little blood that skips the foramen ovale and drops to the right ventricle enters the pulmonary trunk. Now, on getting, remember, once you enter the pulmonary trunk, you will definitely enter the right or left pulmonary artery. But immediately when it gets to this point of bifurcation, instead of it to enter right or left pulmonary trunk, it enters the structure we call what? Ductus what? Arteriosus. So this fetal circulation, number one, blood bypasses the liver through what? Ductus venosus. Number two, blood bypasses the right ventricle through what? The foramen ovale. Number three, blood bypasses the lungs through what? Ductus arteriosus. So from the pulmonary trunk, the next thing you have is what? Ductus arteriosus. So once it enters ductus arteriosus, the next thing, let me write this well so that everyone can see. Here you have right ventricle, you have pulmonary trunk, you have ductus arteriosus, you have from ductus arteriosus, what you have here is what? The aorta. And remember, the one that enters the left atrium will enter here, the left ventricle, and from left ventricle it joins to the same aorta. So once it joins to the same aorta, next thing is systemic circulation. And after systemic circulation, the deoxygenated blood now returns back to the placenta through what? Umbilical arteries. After systemic circulation, the deoxygenated blood returns to the placenta through what? Umbilical artery. So that is what happened. Let's write. Now where I stop is, this circulation at some point permits the mixing of oxygenated and deoxygenated blood. Right, deoxygenated blood from the fetus passes to the placenta through two umbilical arteries. That means we have two umbilical arteries and we have only one umbilical vein. Deoxygenated blood from the fetus passes to the placenta through two umbilical arteries. At the placenta, oxygenation of blood takes place, and then the oxygenated blood leaves the placenta through umbilical vein. I said earlier, why I'm wrapping is because we have the privilege of listening to it over and over again. From the umbilical vein, most of the blood bypasses the liver and enters the ductus venosus, while little blood joins the hepatic portal vein to the liver. Both branches, that is, ductus venosus and hepatic portal vein, empties into the inferior vena cava. Both branches empties into the inferior vena cava, where it mingles with the oxygenated blood that returns from the upper region of the fetus through the superior vena, where both branches empties into the inferior vena cava, where it mingles with the oxygenated blood returning from the lower region of the fetus. From the inferior vena cava, the blood enters the right atrium. The oxygenated blood from the superior vena cava also mingle with this blood. Now, continue writing. At the right atrium, most of the blood bypasses the right ventricle and enters an opening between the right and left atria called foramen ovale. At the right atrium, most of the blood bypasses the right ventricle and enters an opening between the right and left atria called foramen ovale, and then to the left atrium. Only little blood in the right atrium enters the right ventricle. Only little blood from the right atrium enters the right ventricle. Now, the blood in the left atrium enters the left ventricle and then enters the aorta for systemic circulation. And the little blood that enters the right ventricle enters the pulmonary trunk, and from the pulmonary trunk it enters a structure between the pulmonary trunk and the aorta called ductus arteriosus. From the pulmonary trunk, it enters the ductus arteriosus. I go over it again. The little blood in the right ventricle enters a structure between the pulmonary trunk and the aorta called ductus arteriosus, so that most blood bypasses the fetal non-functional lungs, so that most blood bypasses the fetal non-functional lungs. This blood in the aorta now joins with the one that enters the aorta through the left ventricle, and the blood is now carried by the aorta to systemic circulation, and the cycle continues again. Now, little thing I'll have to tell you circulatory changes at birth. Once they give birth to a baby, the placenta is being expelled, so oxygenation takes place in the lungs now. So many changes happens. I'm going to give you the little things that happen. Hope I can clean this. Look at it very well, because I'm about to clean it. Can I clean? Now, subheading, write circulatory changes at what? At birth. Circulatory changes at birth. Circulatory changes at birth. Now, at birth, when the baby is delivered, the placenta is expelled and the umbilical cord is tied off. At birth, when the baby is delivered, the placenta is expelled and the umbilical cord is tied off. As the baby takes the first breath, the pulmonary, portal, and other postnatal circulations are established. As the baby takes the first breath, the pulmonary, the portal, and other postnatal circulations are established, and the following vascular changes takes place. And these changes I'm going to mention, some happens immediately, but most of them takes duration like 3 months or 4 months. But the fastest one to happen is the closure of the foramen ovale to fossa ovalis. Let's write the following vascular changes takes place. Remember, the placenta is expelled and the umbilical cord is tied off. The following vascular changes takes place. Number 1 is that the umbilical arteries changes to medial umbilical ligaments. The umbilical arteries changes to medial umbilical ligament. What that means is, if you open your body now as a normal person, in place of umbilical artery, what you have is a fibrous tissue that is called medial umbilical ligament. Number 2 is the ductus venosus changes to ligamentum venosum. The ductus venosus changes to ligamentum venosum. Ductus venosus changes to ligamentum venosum. This means if you open the human body, where you're supposed to have ductus venosus, what you have is ligamentum venosum. So if somebody asks you, the primitive ligamentum venosum is dash, the answer is what? Ductus venosum. Alright, number 3 is that umbilical vein becomes ligamentum teres. Umbilical vein becomes ligamentum teres. Umbilical vein becomes ligamentum what? Teres. That means if you open the human body where you're supposed to have umbilical vein, what you have is what? Ligamentum teres. Now, number 4, foramen ovale closes, and the little tissue that you see in that place is called fossa ovalis. That means the foramen ovale is closed and the tissue left is called fossa ovalis. If you open your heart now, what you should have in place of that is fossa ovalis. This is the fastest to close. Once the baby takes the first breath, blood goes to the lungs. As the blood returns to the left atrium through the umbilical vein, that force closes this place immediately. This is the fastest to close. If this hole refuses to close, that is when you say somebody have what? Hole in the heart. Now, number 5, the ductus arteriosus now changes to ligamentum arteriosum. Ligamentum arteriosum. Alright, so that is where we're going to stop for today. November group. Go and read for your exams. I wish you all the best. I wish you happy stay. I miss you all. Thank you. Saizu loves you.